Hello again, this is Jonathan Wright, Dr. Wright, according to the University of Michigan anyway. Today's topic is going to be trigger fingers. Well, in the first place, what is a trigger finger? Well, you might not know if you hadn't experienced it. Trigger finger is where a finger sort of gets stuck in a certain position and you have to go, to pull it out of it. It's not all that uncommon, but we're usually told that, well, either we can go, and pull it out of it, or there's a surgery which will make it so it's not stuck in that certain position anymore, that kind of trigger position. That's why it's called a trigger finger. All right. So what to do? What can you do besides, if it's stuck, besides pull it out or do surgery? Well, it's actually easy, folks. I learned this from a Dr. John Ellis. Dr. Ellis wrote a book called The Doctor Who Looked at Hands. And no, he was not a hand specialist, but he looked at hands a lot because he was a general practitioner in a farming community in Texas before milking machines. And what Dr. Ellis taught us all, and it has worked for every person that I've relayed Dr. Ellis's information to since, was vitamin B6. Dr. Ellis says, you just have them start taking vitamin B6 and they won't notice much for a little while, maybe a couple, 3 weeks, and then things start getting better and ultimately the trigger finger's gone and then you can cut back on the vitamin B6 or cut it out entirely. Dr. Ellis had people take vitamin B6. I ask people to use a form of vitamin B6 which is the active form, because actually our bodies have to take that vitamin B6 and activate it. It's a chemical process called activation. But now active vitamin B6 is sold in capsules in all the natural food stores and the Tahoma Clinic Dispensary and the compounding pharmacies. It's sold as pyridoxal 5-phosphate. And no, in case I can't remember to spell that, I'll just tell you what it says on the label. Pyridoxal 5-phosphate is abbreviated as P5P. It says P5P, 50 milligrams, 50. And what I ask folks to do is take one of those in the morning, one at night, one in the morning, one at night, till the trigger finger goes away. And then the person can usually fall back on a multiple vitamin with some regular vitamin B6 in it. Yep. And they usually don't have to take that pyridoxal phosphate again, because once it becomes unstuck, it seems that it stays unstuck. So anyway, folks, that's what you can do about trigger finger. You do not need to have surgery. You do not need to keep yanking at your finger all the time to get it back into the proper position. You can do as Dr. John Ellis taught us all in his book called The Doctor Who Looked at Hands. And yes, you can buy that book on a used book search engine anytime you like. Not too expensive either. And that's vitamin B6, pyridoxal phosphate, P5P, 50 milligrams twice a day till it's gone away. And that is that. Thank you for listening, and thank you for watching.